Hi, welcome everybody. My name is Marlena Orloff. I'm a medical oncologist treating uveal melanoma at Thomas Jefferson in Philadelphia, Pennsylvania. And I'm joined today by John. John, do you want to go ahead and introduce yourself?
Hi, I'm John Davis, currently living in South Dakota. I've been a uveal melanoma patient since Thanksgiving of 2013 and metastatic starting in February of 2018. And been a patient both here in South Dakota most recently, in Colorado prior to that, and also at Thomas Jefferson University Hospital.
How did you find out you had metastatic uveal melanoma?
So when I began my uveal melanoma journey, I'd seen Dr. Sato. He recommended I have scans done every 6 months. I was scanning the lungs with X-rays and then the liver with MRIs. And I just about made it out of the danger zone. I was 4.5 years in when I was about to go to 1 year scans when they discovered a tumor on my liver through the MRI. So subsequent to that, since I just had the singular tumor, I did an RF ablation locally in Colorado at the time. Fortunately, I'd been kind of set up for that as I was looking in advance for what kinds of things to do in the event I had metastasis. And so I did an RF ablation. And I've subsequently since then had multiple tumors in the liver, which have been treated, but I've been tumor-free there for 6 years now, or 5 years now, and also tumors in the brain, lung, and some other areas of the body.
Do you remember when you were first diagnosed with that singular lesion on the MRI? Do you remember how big it was?
As I recall, it was less than a centimeter,
Okay.
is as close as I can come.
Yeah, so you were getting scanned pretty frequently and it was picked up pretty early. And,
Yes.
and you had a biopsy right before at the time of the ablation?
They did do a biopsy of I think they were planning on doing a biopsy of the ablation and ended up, at the time of the ablation, they ended up not doing it,
Okay.
as I recall. And it was just kind of walks like a duck, talks like a duck. We assume that's metastatic ocular melanoma.
And then following that ablation, you were then getting scans, I imagine, at probably an increased frequency to monitor for other tumors.
Yes. Yeah. And we went to every 3 months. I do remember asking Dr. Sato, what do we do about the brain? When does that show up? And he said we should probably start scanning for that every year. And a couple of years into the scans for that is when we picked up the first brain tumor.
Sounds like after the ablation, you kind of went to more closer scans, follow up every 3 months. And so, what were the next steps after a new tumor developed after that initial one was ablated?
So I was fortunate in that the next tumor showed up about 6 months later. It was another singular tumor, which I did ablation for. Sadly, the next one had 3 or 4 tumors for which doctors had recommended we need to take a different approach. And that's when I entered a trial at the beginning of 2020, where they did a radioembolization to the liver to treat those 3 or 4 tumors. And that's since subsequent to that, I've not had any more liver tumors. Although I did have one additional tumor outside the liver that on the trial they decided could be treated with regular radiation. So I went through, and that was a much larger tumor. They treated that one with radiation, which came with its own complications. But I followed up the radioembolization with ipi-nivo treatment for a few the combination ipi-nivo for a few months, and then just nivolumab for the subsequent 3 years.
Okay. And at any point on that journey, have you had your HLA tested?
I did at the when we got to the point where I believe it was before we got to the 3 or 4 tumors. Dr. Sada tested the HLA, and I was HLA negative. I think that was around the time frame that options were coming available for people who were HLA positive. So we kind of put that in the file, if you will, and determined later. It kind of went into factoring how we're gonna approach treating any more tumors that popped up. So when we did have the additional tumors, that's kind of directed us to the new trial that was starting at Thomas Jefferson.